look at the study of illness and start understanding cells and cellular components and understand what actually creates disease.
You know what fascinated me there was when I saw the damage to the liver. It was so shocking to see what a
cirrhotic liver, horrible.
It was terrible.
It looks, well, you can see also from cancerous tumors, they just look ugly. They just look ugly. You can see that tissue is abnormal. It's not okay. This is an understanding a little bit more about the process of disease. In other words, something causes a trigger, a physical or physiological stressor, which causes an alarm reaction. So the body immediately goes into fight or flight. Immediately. The moment it does that, it stimulates something called the sympathetic nervous system. Not adrenaline, the sympathetic nervous system, which in turn goes to the adrenal glands and releases adrenaline, noradrenaline, and cortisol, your stress hormones. They are released as a result of a stressor, not for any other reason. Normally they maintain a state of homeostasis and balance. So an impact on the organism of an emotional impact, a mental anguish, a physical impact, danger, damage, disease, any of those things immediately causes the body to go into sympathetic nervous system overdrive. It does it immediately because it's trying to protect itself. So what does it do? When a stressor such as a life change occurs, a person can respond in one of two ways: by adapting successfully to the thing and learning to live with it, or failing to adapt. If it doesn't adapt, a maladaptive response to stress will result in disease. And the underlying stressor may be real or perceived. Now, that's an interesting point I need you to please note. Real or perceived. The body does not understand the difference between a physical thing and an emotional thing. It has the same impact. Please understand that.
What we teach in hypnotherapy, I think you've learned, Janneke, the subconscious mind doesn't know the difference between reality and imagination.
It's all the same.
I'll pick that up a lot.
So if somebody has got a severe sleep disorder, psychological stress, or whatever, it has the same impact on the body as if it would be a physical thing. The body responds in exactly the same way. And you're going to disturb homeostasis, and as a result, you're going to have a disease process happening. So the body, you have a stress, you have an alarm reaction, the body goes into resistance, and the immune system is activated. You either recover from it, or you go into an exhaustion phase. So if the stressor is chronic, again and again and again, the body does not have a chance to adapt or recover. And that is where your chronic illness comes in. Because now it's so busy trying to survive all the time, it never has a chance to heal. Let me ask you the million-dollar question. Where is probably close to 100% of humanity right now?
What?
Where is, in what area, when it comes to this, where are we right now about most of humanity? From the point of view of where are we in this organization?
The pandemic is causing a lot of stress for people.
We are in survival. Remember, our basic organism, like I explained to you right in the beginning, is to survive. It wants to survive. It's living. So it needs to breathe, it needs to drink, it needs to eat, it needs to communicate, it needs to move, it needs to excrete, it needs to reproduce. If any of those 7 things are threatened in any way, you are going to have an immediate flight or fight response. Immediate. Because it senses a threat and it goes into overdrive to try and contain the threat. If it's small and they're spaced out and there's time for the body to adapt and recover, it will. But if not, if it's chronic, and right now with our humanity and where we are right now, we all seem to be in chronic survival mode. Speak to anybody. The only people that at least have some awareness of all of this are people that have done other alternative things and have looked at the body from the point of view and understood that your emotional and your mental nature drives the body as much as its physical body does. It's the same. The body does not understand the difference. So the response is the same. You can have somebody who's had no physical injury done to them whatsoever, but they're busy wasting away from mental or emotional anguish. Has the same effect. You don't assimilate nutrients. You, oh dear, what have I done? I think power.
Press the button.
Yeah, I don't know what I did there. Okay. Let's look at the homeostasis, what this word